Phase pose is classified into two types as arbitrary and kinematic. Again, arbitrary phase pose is divided into two types as fascia type and earpiece phase pose. Arbitrary phase pose is a type wherein hinge axis is located approximately. It is most commonly used for complete denture patients. It uses arbitrary or approximate points on the face as posterior reference points. The condylar rods are positioned on predetermined points and the opening axis is within 5 mm of the true center of the opening axis of the jaws. Fascia type phase pose uses approximate points on the skin over the temporomandibular region as posterior reference points, and the points are located by measuring from certain anatomic land areas on the face. The disadvantages are this phase pose is placed on the skin, which is movable and also requires an assistant to hold the phase pose in place. Earpiece phase pose was first determined by Dalby and uses the external auditory meatus as the posterior reference point. Special earpiece is required instead of the condylar element so that it could be comfortably seated inside the external auditory meatus. The advantages are it is simple to use, does not require any measurement on the face, it is as accurate as other types of phase pose, it provides average anatomic dimension between the external auditory meatus and the horizontal axis of the mandible. However, the disadvantages are an error of 0.2 mm from the axis can always be expected, but when coupled with the use of a thick intraocclusal rickwatch which is made at an increased vertical dimension, it leads to a considerable amount of inaccuracies. Coming on to the kinematic phase pose, this determines and locates the exact hinge axis points. The fork is attached to the mandibular occlusal rim instead of the maxilla, and this type of phase pose are indicated when precise occlusal rehabilitation needs to be done, as in full mouth rehabilitation or in fixed dental prosthesis. The drawbacks are it requires extensive chairside time, the device is expensive, and it is rarely indicated for routine articulators with prosthodontic procedures. Coming on to the parts of the spring bow or phase pose, it consists of the condylar rods and it consists of the U-shaped frame, it consists of the bite fork onto which the occlusal rims are attached, and it has the locking clamp and then the orbital pointer wherein the orbital is used as an anterior point of reference. The U-shaped frame is the main frame of the phase pose. All other components are attached to it. It extends from the region of the temporomandibular joint on one side to the other side without contacting the face. The condylar rods are nothing but two small metallic rods that extend on either side at the free end of the U-shaped frame. It is used for location of the hinge axis and it is employed while transferring it to the articulator. Some phase pose also have earpieces that fit into the external auditory meatus in the place of condylar rods. The bite fork is attached to the occlusal rims while recording the orientation relation, and it is attached to the frame with the help of a rod called as the stem. The locking device helps to fix the bite fork to the U-shaped frame firmly while recording the orientation jaw relation. The third points of reference, these are the reference points or anatomic reference points which are used on the face along with the two condylar reference points. There are various anterior reference points as orbital pointer, or when nose piece is used, nasion is also employed as an anterior reference point. By obtaining the plane of orientation, the maxilla should be positioned in space by 3 points. We are able to relocate it with the help of 2 posterior points and 1 anterior reference point. Thereby, we are able to obtain a spatial location of the maxillary occlusal plane. These are examples of anterior reference points. We have orbital minus 7 mm, nasion minus 23 mm, and ala of the nose. Orbital is the lowest point of the infraorbital margin. It is palpated easily on the overlying tissues and skin, and along with 2 posterior reference points is used for simulating the FH plane or the ala tragus plane. Orbital minus 7 mm was given by Gonzalez. He was the person who recommended this technique for location of this maxillary plane. Nasion minus 23 mm was employed when Whip mix articulator was used, and it uses a crossbar which is located 23 mm below the midpoint of the Nasion pointer. Ala of the nose can also be used as an anterior reference point, and this line, which extends from the ala of the nose to the superior border of the external auditory meatus, tragus of the external auditory meatus, is called as the Camper's line. When this line is parallel to the plane of the occlusal rim, it is used as one of the near normal plane parallel to the FH plane. The advantages of anterior reference points are: it is used for determining the reference plane, the level of mounted cast is able to be determined, it establishes a baseline for comparative studies between the patients, and it can also visualize the anterior teeth and occlusion in the articulator in the same reference plane. Moving on to the posterior reference points, we have a set of reference points which are mentioned in the slides. It is based upon the authors who suggested these points. Now coming on to the recording of the jaw relation, orientation jaw relation with the face bow. Seat the patient comfortably on the dental chair with the backrest at an upright position and mark the condylar points. Prepare the occlusal rims. Attach the bite forks. Always ensure that the stem of the bite fork extends on the left hand side of the patient so that it enables easy visibility, and then attach the U-shaped frame of the face bow. Insert it into the patient's external auditory meatus if it is a earpiece type of face bow. Tighten the fork. Remove once the anterior plane is determined. Ensure that the posterior plane is also made parallel, and then lock the device and remove the face bow and transfer it onto the articulator.